Hi, it's Dr. Richard Downs of Sleep Balance Academy. I'm going to show you 3 forms. These are the screening forms that we recommend from Sleep Balance Academy. And I'm going to show you 2 new forms that are required for use when we have our sleep physician do a telemedicine call with your patients. So let's take a look at those forms. So many of you have already seen this form. This is the Sleep Balance Academy screening form. It's a 30-second form or 1-minute form that you fill out for a patient, and it allows you to decide whether they need a sleep study or not. There are 3 sections to it, as we mentioned before. And the first section is the medical questions. But depending on what they select for yes or no on each of these questions gives you the number of points that you finally add up and put here at the end, so that you know what the total score is for that section. Then there's the Epworth Sleepiness Scale, which a lot of insurance companies want. And we can do that Epworth score here, and then depending on the range of that score, we can give the number of points down here. And lastly are the sleep, spine, and dental questions. Again, there's 3 questions here. Each of them have weighted amounts for points. And again, you can put that score here. And if you add all 3 sections up, then you get a score of 7 or more, then that indicates that you might want to order a sleep study for this patient. It's very quick, it's very easy, and the patient can visually see why you're ordering a sleep study. Now, 2 more forms have been added to my list because Dr. Ali and Dr. Zelk, who do our telemedicine sleep studies, want you to use these forms for their particular clinic in order to authorize them to do a telemedicine study with your patients. So if you're going to order a telemedicine study, you need to use these forms. And you don't have to use this form that I just showed you if you're going to go that route. So let me show you those 2 forms. Okay, so here's the Better Sleep Center sleep study order form. Let me just get that for you. Move it up here. Okay, in this form, we're trying to get a authorization to do a sleep study, an actual HST. And some insurance companies require you to have a physician prescribe taking that home sleep study in order to have benefits to the patient's insurance. Now, if you're not using insurance, you don't need to do this. But if you're in a state where dentists cannot order a sleep study, there are presently 5 of them that don't allow dentists to order a sleep study without a prescription. And there are also some insurance companies that require, if they're going to cover, a physician order that. And that's what this form is for. Now, in this form, and especially Medicare is true. That's true of Medicare for sure. So in this form, you fill out the patient demographic information here, and also you put your name here as the ordering doctor and your phone number, okay? Then you fill out this portion of the form where you can talk about the things that you see on the patient, okay? And you can even see the ICD-10 codes here, okay? And then the supporting diagnosis, they snore loud, they have restlessness, so they're drowsy during the day. These are just more things that you can add to the supporting documents for why you want a sleep study. And you can see there are also some codes in here for this. Now, this last section, I authorize the following sleep study. That is not to be done by you. The referring physician, Dr. Ali or Dr. Zelk or some other physician, will use this section to order your sleep study, okay? So as you can see, they can just check off which ones they want, and then the patient information is down here. You might want to fill in the weight and the height for the doctor, but you don't have to. Dr. Ali can do this as well. And then the ordering physician, this is the prescription order that Dr. Ali will sign. You don't sign this area down here, okay? And again, as you can see at the bottom here, by signing this physician is attesting that they've done a face-to-face evaluation with the patient, either by personal face-to-face or telemedicine, and it satisfies the requirements of Medicare right there. Okay. All right. So that form is to be filled out if you need a prescription for a home sleep study. Now, the next one is the form that you can use that would be similar to what I had before. And this one is called the sleep apnea screening form. All right. And this is also from Dr. Ali and is accepted by Dr. Zelk. Now, as you can see in this form, we're doing a screening just like we did with my form. And you can see that we have yes, no scores for snoring. Have you been reported to stop breathing while you're sleeping? And you can score it here with different points. What's your collar size for a male and a female? Do you occasionally fall asleep in the day and then when you're active or not, or you're driving at a stoplight? Some of the same things that are on the Epworth scale are listed here. And then the point scales are given here, the overall score in that section. And then again, you have another Epworth screening area right here, okay? And that Epworth screening area is again, just like the one I had on my form. And that score is something that a lot of insurance companies want. Now, it isn't very useful as far as I'm concerned, but if the insurance companies want to know a sleepiness score, that's what you do here. And you sign it and date it. So this form is also something that Dr. Ali and Dr. Zelk want when they're going to do a telemedicine call with your patient. So fill out this form, and I would say you can use this form instead of the form that we have developed through Sleep Balance Academy. That way you have less paperwork to do. So this form and the form for the prescription for HST are the two forms that we really want you to fill out. This is the screening form that can substitute for what we have at Sleep Balance Academy. And the prescription form is something you have to put together if you want a sleep study authorized by a physician. Thank you very much.